Let's cross to former Foreign Minister Alexander Downer in London. Good to talk to you again, Alexander. We haven't got much time. I want to just get onto this issue of the debate about opening up. London, of course, the UK started to open up. You've written brilliantly in the Australian Financial Review. You say the deification of unelected chief medical officers in Australia means there's been no genuine political debate here about how best to balance the response to the virus. Do you think this is hurting us?
Well, look, as you were saying earlier, with the debate that you've just been having, you can't eliminate COVID. All you can do is protect the vulnerable and vaccinate as many people as possible. But even people who are vaccinated can, it's unusual, but they can contract COVID. So, for example, the UK Health Minister, he has been vaccinated and he actually has contracted COVID. So you can't eliminate it. And the problem with the Australian approach is that the chief medical officers say, well, we can in effect eliminate COVID altogether if we just close down all of our states one by one. And I think looked at from afar, that seems a strange approach because you've got to get the balance right. You can't destroy the whole of society. If you want to eliminate COVID, then people shouldn't make any contact with each other at all. And why don't we do that? Well, that's for obvious reasons. Society would collapse. So you have to get the balance right. And I think in the UK, they've made some mistakes. They've done some things badly. They're not a model at everything that they've done up until now. But I think now they've probably got the balance pretty much right.
Yeah, they've been through hell in the past. They've been saved by AstraZeneca, strangely enough. Just tell us how things have progressed since Freedom Day. Is the virus doing any more damage than it had done beforehand?
Well, it'd be too early to make any judgment about that, but there aren't any signs of that at the moment. There was an upsurge in COVID cases. But a COVID case doesn't necessarily mean somebody is sick or very sick. The levels of hospitalisation and death, they have not been increasing proportionate with the increase in COVID cases. But those COVID cases are coming down now. They've had 7 consecutive days of declining COVID cases. And all of this is in an environment where the country is not 100%, but pretty much 100% open. You can do what you like. In some places, they ask you to wear masks. That depends on the proprietor of a shop or whatever it is. But generally speaking, it's pretty open.
Thanks for that update, Alexander. Sorry we had not much time for you this week. We ran over a bit. Thanks to Kat. Thanks for your time. Alexander Downer there live from London. I think London and the UK is so important for Australia to keep watching because it gives us a good guide on AstraZeneca. As I keep saying, that's the vaccine that saved the UK. And also we can see how they're proceeding now that they've opened up again with those vaccinations in place.